Hello, my name is Joan Gibson. I'm a bioethicist here in New Mexico. Thanks to the Senior Citizens Law Office for supporting this video. I'm delighted to be with Dr. Nancy Guinn, a palliative care physician here in New Mexico. And we're going to talk today about DNR orders, do not resuscitate orders, and cardiopulmonary resuscitation. So, Dr. Guinn, I guess I can start with a question for you. The other day, I was with a friend as she was being admitted to the hospital for treatment for pneumonia following a bad cold. And one of the questions that they asked her was, if your heart stops beating while you're in the hospital, do you want us to perform CPR, cardiopulmonary resuscitation, to restart your heart? Do they ask this question of everyone?
They do, and sometimes multiple times during a hospitalization. You will be asked this question in the emergency room by the emergency room physicians or a nurse associated with them. And then when you're hospitalized, if the emergency room and the hospital physicians together decide it's appropriate, they'll probably ask you again.
What exactly is CPR?
Cardiopulmonary resuscitation, you named it, is something that was actually, the modern version was created only in the 1960s. It's not been around a long time. And it was originally designed for rapid response to sudden heart attacks or maybe to a drowning in a case where it was felt that a sudden series of actions might actually bring that person back. And over time, it spread to being almost a universal medical procedure offered to everyone. So it's really changed how we use it and what we do with it. It is a process where if your heart stops, a very specific set of medical procedures will start if you agree to it. And we're all trained in it. It's it's very specific what happens, when it happens, who does what. It's meant to be very well coordinated. What they will start with is usually compressions on your chest to try to get your blood circulating, right? They're trying to replace the circulation of the heart. Then they'll administer electric shocks to try to restart the heart. And then usually at that point also the decision is made to place a breathing tube in the throat and down into the lungs and to actually breathe for the person using a big kind of plastic ventilator and then hooking up to a machine. If one goes through this process and one survives it, the general thing that happens is that someone will end up in the intensive care unit on machines using strong medications to try to support them to see if they're able to recover.
My friend and I were wondering, does this usually work? She's 78. She still lives at home alone. She is on oxygen for breathing issues, COPD, I think, but she still drives. She loves to go to concerts and play cribbage with her friends at the senior center. If she says yes to cardiopulmonary resuscitation, will it likely bring her back to where she can still do all these things?
It's a really good question to ask, and we don't ask it enough. It turns out if people really understand the chances of survival, they make very different decisions. So in general, people who have their heart stop in the hospital and receive CPR, the whole population in the hospital, as many as 15% of those people can survive.
15%?
That's just the beginning of the story. To survive to discharge from the hospital. That means of every 100 people that receive CPR, as many as 15 survive. However, if you take into account age, your friend being 78, and having a known condition like COPD, a pulmonary diagnosis that requires oxygen, that number falls down much lower, maybe as low as 5%. So of 100 people receiving the CPR procedure who are in your friend's state of health, maybe around 5 of them will survive to leave the hospital.
They explained to her that if she says no CPR, they would then write do not resuscitate, DNR, in her chart. And my friend was concerned if she chooses not to have CPR, Will she still be cared for? Will she still be kept comfortable?
I think that's a really good question, and many people ask it. There's a lot of concern that if you indicate that you do not want that last final procedure done after your heart stops, when you have actually died naturally, that people will somehow neglect you in the hospital. But what should happen, and does happen, is that you receive every form of medical care appropriate up to the point of your heart stopping. So for her, if she had pneumonia, that would include receiving antibiotics, IV antibiotics, fluids, any other medical treatments that might be appropriate to support her breathing, and all of the full medical treatment for a pneumonia should happen, and she should receive that. The concept of comfort care is something we offer people when they really have said, I feel that I am dying and all I want is to be kept comfortable. But that's not what your friend is saying. Your friend is saying, I have pneumonia, I want treatment, I just wouldn't like my heart restarted if it stopped. And that's the limit that I have.
That's reassuring. So when my friend leaves the hospital, let's say she has agreed to a do not resuscitate order, when she's back at home, will that order remain in place? Say emergency ambulance folks come, and will they honor that order in your home?
Only if there's a piece of paper that is visible to them. They are very well trained to manage resuscitations and to do everything necessary unless they have evidence that this person doesn't want it. So there are two forms available. There's many forms, but two forms that are recognized widely throughout the state of New Mexico to be forms that indicate that someone does not want to be resuscitated once their heart stops. And there's a New Mexico DNR, do not resuscitate form, and there's another form called the medical order for scope of treatment. Both of those are regarded as forms that the ambulance paramedics can use to determine that it is not appropriate to resuscitate. They're trained to understand those forms.
My friend and I were also wondering, are there other important medical decisions, advanced planning we should think about ahead of time before the next emergency or going to the hospital? I know, for example, that the Senior Citizens Law Office has other videos on its website that will give folks an idea of decisions that they can make ahead of time. What else should we be thinking about besides CPR and DNR orders?
I think the most critical thing is to name a healthcare decision maker, someone who understands what your wishes are and can help interpret them for the medical system if you're not able to speak for yourself. So that's the critical thing. Who will speak for you if you can't speak for yourself? And do they really understand what you want and don't want? So that's the most critical thing. Sometimes we refer to that as a healthcare power of attorney, healthcare decision maker. You'll even hear other words describing it, but those are the two most common.
And I do know that one of the videos from the Senior Citizens Law Office is a video on how to designate a healthcare power of attorney. I also know that there are ways to let others know. For example, you can have a wallet card inside your wallet that says, my daughter is my healthcare power of attorney. And also, one can use your smartphone, be it an iPhone or an Android. And increasingly, paramedics are being trained to look for that on your iPhone. And what they really want to know is whom to call. And I think that's also really important. And I guess the last question I have, we're talking about older folks. When should we start thinking about, let's say, designating a healthcare power of attorney? Does this apply to younger people as well?
Definitely. And of course, it's not something we think about when we're younger. But having someone who can speak for you if you can't speak for yourself, perhaps after a sporting accident or after a car crash, can be critical. And it's really, really good that the emergency system know who to turn to to discuss your medical condition.
So maybe from mid to late adolescence on, making sure that we have designated and talked to somebody who will make medical decisions for us when we can't. Thanks very much.
Thank you.
Appreciate that.